Hey guys, this is Dr. Trey Martin with Pursuit Physical Therapy. Today I want to talk a little bit about thoracic outlet syndrome and how that impacts baseball throwers and other overhead athletes. So for those of you guys that are unfamiliar, thoracic outlet syndrome it's either a neurological or a vascular type condition, and here's what happens. So we have our thoracic outlet that runs through this region here, and we have a bunch of nerves and blood vessels that run all the way down through the arm into the hand. So one common thing we see in throwers is as we throw, these muscles in this region here, called the scalene muscles, can grow and hypertrophy from the strain of throwing. So what happens then is these muscles get bigger and they can occlude the space that the thoracic outlet goes through. So some of the symptoms you can see, like I mentioned earlier, you can either have a vascular presentation, and that'll be an interruption of blood flow. So you'll feel things like cold hands, numbness in your hands, and maybe loss of a pulse in your hand region. And you could also have more of a neurological response. So you'll feel more of a tingly type nerve-like sensation that can follow a pattern down through your hands depending on which nerve is being impacted at that time. And then also you can have a mix of both, where you have both neurological and vascular symptoms. So this is a condition we're starting to become more and more aware of in the baseball realm, especially just due to the sport of overhead athletes and how throwing impacts the scalene muscles that I mentioned earlier, and just the strain and stress that we place on the thoracic bundle where the thoracic outlet anatomy runs. So, as I said, super common things to look for are things like you feel like you're losing a little bit of feel in the fingertips. Maybe you have cold hands at some point and it's more one-sided than the other. And from a physical therapy perspective, we have some tests that we can use that help identify the cause of thoracic outlet, or the etiology of thoracic outlet syndrome, and we can help better identify what's going on there. So with that being said, one of the other things too that we can see is, I think there's a little bit of, if you guys are familiar with the yips, I just wrote a blog on my website about the yips. I think there's a component too with thoracic outlet syndrome manifesting in the form of the yips, where, for those of you guys don't know, you have issues throwing the ball back to the pitcher. If you're a catcher, throws from like second to first base, you just feel like you lose a little bit of touch in your finger, and then you start thinking that your throwing mechanics are off and you just feel a little bit off, and then that becomes a psychological phenomenon that can manifest pretty severely in a yips-like presentation. So a couple things that we can do when treating thoracic outlet syndrome is a couple things. One is, if we take time off throwing, then obviously the scalenes will atrophy some, so that is a solution. Two, we can work on things like clavicle mobility here, and then our first rib is actually in this region here too. Working on mobilizing that too can also help clear up any impediments of the thoracic outlet. Another couple spots too that are really important is maintaining full neck range of motion through rotation, side bending, flexion, and extension. So we really need good quality neck range of motion, and really attacking the scalene muscle is going to be a key part of this treatment session. We don't need those to get hypertonic. You can get even more advanced type things. We see people now in the major leagues. Matt Harvey, a few years back, he had a cervical rib removed. So by cervical rib, normally our ribs come off the thoracic spine, but we can see with throwing, the strain of throwing can cause a little bit of a bone formation to happen even from the cervical spine, and this can actually even impede flow even greater. So Matt Harvey, a really well-known pitcher for the Mets, was struggling with this issue. His hands were cold and he couldn't throw, so he had surgery where they removed the rib. And Markel Fultz for the Orlando Magic is another well-known case of, he was having issues shooting wise, and they found thoracic outlet syndrome. So again, if it can't be managed conservatively through things like physical therapy care, a good exercise program, and things like that, there are other options out there as far as surgical removal of things like a cervical rib or even the first rib of the thoracic spine to help clear up space. Another treatment I've seen is Botox injections of the scalene muscles. So I've seen a orthopedic doctor up in the Massachusetts area who does Botox injections to correct that thoracic outlet syndrome too. So I just want to give you guys a little bit of insight on this phenomenon, and if this is something that you've experienced yourself where you're like, I don't feel quite right, the ball feels a little off, my hands are getting cold, I'm getting tingling in my hands and stuff like that, it could be a manifestation of thoracic outlet syndrome that could warrant either passive, or not passive, but more conservative care through a physical therapy approach to see if that can help, or even a surgical approach at times when the case gets pretty advanced. An important thing to note too is we need to differentially diagnose here too. So a couple of things that your orthopedic doctor or physical therapist will look at: is it true thoracic outlet through different tests checking for vascular compromise, or is it actually more of just like a cervical nerve root issue, or even something else more down the stream that's causing occlusion, or something like even way down the stream like carpal tunnel or something weird like that that's causing the compromise of the neural or vascular structures. But I just, again, wanted to highlight this issue and tell you a little bit about what thoracic outlet syndrome is, what it presents as. And if you have any questions, drop the questions in the comment box. Like I said, I'm Dr. Trey Martin with Pursuit Physical Therapy. You can drop a question there if you think you're having these issues, and we can help you get to the right resources. If you're in the Orlando area, you can stop by our location and we can discuss and discover whether or not you may be having symptoms of thoracic outlet if you're a baseball player. But I just want to finish with this and just let you know it's a fairly common presentation that we're seeing more and more of in the baseball world. So I just wanted to highlight what that looks like, potential options for that, and then just kind of give you guys a little bit more education on what might be happening, and just to let you know that there is probably a reason why you're having these issues throwing and why you're having a little bit of difficulty with either your hands feel a little bit cold, or you have some type of nerve response where you have like a tingling sensation in your fingers too. It is common, and it is something that can be treated conservatively or surgically, and that will help you get back to throwing without pain and improve your performance. So again, if you have a question, drop it in the comment box. Thank you guys for tuning in. Until next time, stay safe out there and throw well. Oh, that's bad.